Hello and welcome to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM. In addition, today, as always, we are on Birmingham Area Municipal Access and on 88.1 WBFH, the BIF, our live TV, radio, and other media outlets each and every day, Monday through Friday, 10 a.m. to 12 noon here on the Oakland County Megacast network of community television and radio stations, where we bring you the latest information about the COVID-19 pandemic and other big news topics from around the local area here on our variety of television, radio, and other media outlets. It isn't just a regular broadcast or a regular simulcast. It is a partnership between community outlets throughout the Oakland County area to bring you the news from your hometown, from experts in the area, at an extensive length, so you have as much proper information as possible during these treacherous times that we are in throughout Oakland County, the state of Michigan, and the world. And we also will bring you the top news stories each and every day on our website, civiccentertv.com/coronavirus. In addition to all of those top stories, we have reputable resources from the Centers for Disease Control, the state of Michigan, Oakland County, and many of our local municipalities here in our coverage area. In addition to our top stories today, including the health department orders mortgage company to enforce measures to stop the spread of COVID-19. Oakland County health officials are ordering United Shore Mortgage Company in Pontiac to enforce social distancing and other measures to stop the spread of COVID-19 after more than 50 workers were confirmed to have the virus. In an emergency order dated Tuesday, health officer Leanne Stafford told the mortgage company her division had received complaints that United Shore was violating a statewide executive order that requires masks to be worn over the mouth and nose when in an indoor space. The company must develop a plan to manage and control distancing and to ensure employees are wearing facial coverings, implement a daily screening process and sick policy, as well as encourage working from home. Failure to comply is a misdemeanor punishable by up to 6 months in jail or a fine of $200 per day, according to the order. And so one of our local companies here, a large company in our area, coming under fire after reports that they are not entirely following the guidelines put in front of them by the state of Michigan and by Oakland County. And this is one of the first examples we've seen since the emphasis that was put forth by Governor Whitmer early on in the week to put more effort into enforcement of these policies, that we've seen one of these policies begin to be more enforced and emphasized to a company in our local area.
I've been inside this office building, and it is massive, but the way it's designed, all of the desks are very close, basically kind of in these pods, and they face one another. I believe they are allowing about half of their staff to work from home through January, so for the rest of this year, but the other ones that are there, it is spreading because they seem to be in close contact. Again, I think we're going to see this on college campuses as well. People, when you are one-on-one, it's so hard to talk with a mask on, so you typically will kind of pull it down or something of that nature. I think the bigger thing here is you're going to have to use hand sanitizer constantly everywhere because you have so many people in that area. It is a huge facility, though. It is. It's a large facility. There's a lot of people working there, so it's easy to have problems like this if one or two people, if a few people, or several people especially, are not following the guidelines, or if there's not proper enforcement on site, knowing all those circumstances are in place and what needs to be done in order to prevent the spread of COVID-19, keep your employees safe, and keep the greater community safe as well. So that an example of enforcement of greater enforcement of these regulations and laws that are in place to protect the community from COVID-19. Other top stories, civiccentertv.com/coronavirus. New cases of coronavirus plateau in the state of Michigan. The number of confirmed cases of COVID-19 has risen to 84,707 as of Wednesday, including 6,221 deaths, the state officials report. Michigan officials reported 657 new confirmed cases and 2 additional deaths on Wednesday. New cases have plateaued in the last 2 weeks while deaths remain flat
in Michigan. Testing has remained steady with an average of more than 25,000 tests per day, with the positivity rate between 3 and 4%. Hospitalizations have increased slightly, but remain considerably lower than they were in the month of April. So Dr. Calhoun talked about this pretty extensively yesterday at the press conference, as did Governor Whitmer, that while we're seeing the plateau, while that spike that we are in is beginning to come to an end, what they want to see, and what would be a positive situation, would be to see a decline in the average of these cases, not a plateauing, because those are still new cases. There's still chance for community spread, and we're still not below that 3% positive rate benchmark in our testing results that is ideal for containing the virus.
But this is still positive news,
Yes.
because we are trending down compared to where we were in March and April. This is good news, and we need to keep it going so that we can get to phase 5. Although I will say, as the governor said yesterday, she does not anticipate that there's going to be any move in that for the next few weeks.
Yeah, I would think about the same. I don't see there being any changes in that regard until at least after the schools have been reopened and have been open for several weeks, maybe, to see if their process is right, if those processes are causing community spread potentially, or are not effective, and so on. So I think we're going to stay in phase 4. But I also agree that the plateau and the spike is definitely good news. It's also definitely no reason to let up again, as we saw late in June, early on in July, and we knew the results of what that brought on to our community and brought on to the state of Michigan. So that's what they were encouraging yesterday at the press conference, is despite our numbers being as good as they are right now, and they're trending in the right direction, or at least close to the right direction, that's no reason to take your foot off the gas, or to stop playing prevent defense against COVID-19. Lastly, among our top stories today at civiccentertv.com/coronavirus, the first Michigan patients received the COVID-19 vaccine. Volunteers are signing up to help find a cure to COVID-19. The first 20 patients received injections at Henry Ford Health System headquarters in Detroit as part of the Moderna mRNA 1273 coronavirus efficacy, or COVE, vaccine study. Half received the vaccine, half received a placebo. The Moderna vaccine was developed in conjunction with the National Institutes of Health and National Institute of Allergy and Infectious Diseases, has now entered phase 3 clinical trials in the race to develop a safe and effective vaccine for the novel coronavirus. Thousands of people have already volunteered for the Henry Ford study of the Moderna vaccine, but more volunteers are needed. To sign up, go to henryford.com/Moderna vaccine. Again, to sign up and find more information about this vaccine trial, you can go to henryford.com/Moderna vaccine. We do have a link to that on our website on civiccentertv.com/coronavirus. And it was great news last week, and in the last couple weeks, as we reported that this was going to be going on. Then we talked to Dr. Manu Malhotra from Henry Ford Health System about this study beginning in that family of health facilities and hospitals, and the need for volunteers. And now we're seeing that being put into action really quickly after it was announced. So the process is still moving forward. We're still really early in this phase of the clinical trials, but any progress on a vaccine has to be considered good progress.
And it's not just this vaccine that is being tested throughout the country. There are a few others as well, and they seem to be promising. This one here in Michigan, there's going to be 5,000 people from our region that they are looking to participate in this study. It just started yesterday. They will get 2 injections. They don't know which ones are getting the placebo, which ones are actually getting the virus, but hopefully this gets us past this next hurdle, because if we could fast track a vaccine and different treatment options, we can move past this pandemic.
Yeah, and hopefully they'll be able to get that done speedily and effectively. I would assume that efficacy of this vaccine is going to be paramount over speed, as we're still able to, like we talked about earlier on in the week with Dr. Jason Wasserman from Oakland University, we're still able to take those measures to prevent the spread of COVID-19. As long as we're taking those seriously, we're going to be giving the medical community the time that they need to create a vaccine in a speedy manner, but more importantly in a safe manner and an effective manner, because you can have a vaccine, but if the vaccine doesn't work well, or if the vaccine causes other issues, that doesn't solve the problem at hand. That story, those stories and more online, civiccentertv.com/coronavirus. In addition, you can find information about COVID-19 from reputable resources federally at the Centers for Disease Control and Prevention, state level from the Michigan Department of Health and Human Services, in the Oakland County website as well, with links to information for scheduling your own tests at drive-through facilities in the county area, and from a number of our local municipalities in our coverage area. civiccentertv.com/coronavirus, your home for coronavirus information in the Oakland County area, as we continue to cover everything that's been affected by the COVID-19 pandemic here each and every day on the show. That, of course, includes this week. One of the bigger factors that it had impacted was our local elections, and we're pleased to be joined to review how that process went in this very special scenario with a government and politics reporter for the Detroit Free Press. We're pleased to be joined now by Dave Boucher on the Oakland County Megacast. Dave, thank you for being with us today.
Sure. Thanks so much for having me. I appreciate it.
Appreciate having you on. Over the course of the pandemic, how have you been? How's your team at the Free Press been doing?
Hey, I'm doing all right. I'm actually kind of a new hire at the Free Press, and so I've met all of my colleagues digitally, but we have been practicing social distancing, and everybody's doing the best that we can.
Well, that's good to hear. It had me an interesting time though, coming in, being such a new employee in an office, in a situation that tends to be very social, very interactive as you're trying to get the news out to the public in an effective manner and in a speedy manner as well. And then coming in during the pandemic, having to form those relationships in the office, in the community, and continue to still report the news in a time that is so news heavy. How much of a challenge was that for you coming in, and how are you handling it so far?
It's been fun. It's been fun. I think it's a challenge for anybody to start a new job, but that sort of challenge pales in comparison to the challenges that Michiganders and everybody every day are facing right now with the pandemic. And so, I've just tried to hit the ground running and call and email as many people as I can, and everybody's been gracious so far and helpful with their time, and just trying to put out as much relevant, helpful news as I can as fast as possible.
That's good to hear, and we are very appreciative of the news that is reported by our local papers. They do a fantastic job. So, on the topic of the election, a very special scenario that we were in. There wasn't necessarily a special election, it was a primary election, but it was special in its own way, given the circumstances of the pandemic, the critical election year that it is in 2020 as we're approaching the general election in November, and the circumstances certainly were different in this election than ever before, as it was the first election that people were able to have no reason absentee voting and same-day registration. From what you've heard out in the community, from local clerks, from local county clerks and municipal clerks, and from just those in the general community, what's your review on how this election went? We expected some delays, we expected it to be a little slower, but all in all, it seemed like it went pretty smoothly.
Yeah, that's honestly the feedback that we're getting from most people. The Secretary of State's office says everything overall went very well, and it shows that everybody is ready for November. We've heard from clerks around the state where they saw that lines at polling precincts were down. They expected foot traffic to be down, and it was down. Some of the problems that we did hear about, your viewers and listeners have probably heard about them. Coming out of Detroit, there were some poll workers who did not show up, and that resulted in some of the polling precincts not being able to open on time. There were 3 polling precincts at least who didn't open on time. One of them didn't open until 9 o'clock. Polls are supposed to open at 7 a.m. So that's a delay. And so some voting rights advocates and others are a little bit concerned about what that means for November. There were other concerns specifically in Detroit about polling place locations. The clerk told me, James Winfrey told me that their office was caught a little off guard when Detroit Public Schools decided to have summer school this year. And so there were about 20 polling places in Detroit that are supposed to be schools. The school district didn't necessarily feel comfortable having polling places in the school while students were there for summer school, which the clerk said she completely understood, but it forced them to kind of look for some last minute changes, what she described as last minute changes. And so we heard from voters who were a little bit frustrated when they got a memo or a letter in the mail on the Monday before the election that said, no, you're not going to vote at this place where you've always voted. You're going to vote somewhere else. I talked to a poll worker in Detroit who said that all day they had people coming in and they were shocked that they were supposed to be voting there, or they weren't sure if that was the right polling precinct to be at. So those are some of the logistical issues. But again, that was focused in Detroit. That was some of the there are 500 plus precincts in Detroit, so it wasn't massively spread out, but it was a point of concern. And then, of course, as you mentioned, these are strange times, and so many more voters voted via absentee, via a mail-in ballot, or dropped off these absentee ballots early. And so some of that counting took some time. So some clerks are a little bit nervous about how much time they're going to need and how many more people they're going to need to count all the ballots that they anticipate receiving for the November general election.
So, Dave, speaking about the November election, if you had a crystal ball, what problems do you foresee for the general election which could have extremely high voter turnout?
Yeah, so it's tough to predict everything, especially in the unpredictable times that we're living in right now. But if the pandemic remains at current levels or gets worse, as some people anticipate, participation in absentee ballots is expected to remain very, very high. This election, there were roughly 1.6 million, a little bit more than 1.6 million absentee ballots that were cast in Michigan. Election experts expect that could go up to 3 million absentee ballots, if not more, for the November general election. And so clerks are a little bit nervous about having the number of the right amount of staff and the machinery necessary to count ballots. Counting ballots sounds like a relatively simple and perhaps monotonous or tedious process, but it just requires time, people, and equipment to do that. So clerks have high-speed tabulators. They have high-speed envelope openers. That's a thing that I didn't know existed. But when you're opening, 100,000 envelopes, it takes some time to open up the envelopes. So just the timing and the logistics are a little bit nerve-wracking for clerks. Also, the way that Michigan law is set up right now, clerks can't even open absentee ballots until the morning of the election. So, for example, the city of Lansing had 17,000 absentee ballots. The city of Detroit had 75,000 plus absentee ballots, and they can't even open, let alone count those ballots until the morning of the election. And so there's some legislation that is proposed that while it wouldn't allow clerks to count ballots, it allowed them to, at the very least, open up the envelopes and process these ballots so that they could start the counting process a little bit earlier. Clerks are telling me if that law doesn't change, that's just going to mean that it's going to take longer for them to do everything. It means they're going to have to try and hire more election workers, which is a problem all over the state. So if they can't hire more people and if the ballots stay high, it could just result in a delay in getting results in November.
Dave Boucher with us. He's a government and politics reporter at the Detroit Free Press with us on the Oakland County Megacast. Dave, on that topic, you mentioned the legislation that's been thrown out there with the potential of allowing these clerks to at least open those ballots before the day of the election and begin the counting process. Do you believe, based on your conversations or your knowledge with, in terms of members of the legislature and even Governor Whitmer to that level, that this would be legislation that could pass in time for November and be in place to allow these clerks that relief that they are calling for the November general election, where turnout is expected to be much higher than it was in this primary?
I would say it's hard to say. In general, in theory, when legislation has support from Republicans and Democrats, it seems like the likelihood of it passing goes up, right? And so there's legislation that's been introduced by Senator Ruth Johnson, the former Republican Secretary of State in Michigan, that would allow clerks to, at the very least, open the envelope, not take the ballot out, but open the envelope before Election Day. So that bill has been introduced. Some people believe that it's a popular bill, but it hasn't been passed yet. So we're digging in a little bit more to kind of see what some of the fears there or concerns are there. In general, we think that some of the concerns about opening up ballots a little early are around fear of either voter fraud or, if people start counting ballots early, then maybe the results of the count get out and it affects the ultimate voter tally. Now, I'm sure you guys know this too, but many states around the country do early voting and mail-in voting. Oregon only does mail-in voting. And so, other states have figured out how to count ballots that come in the mail or come early and not let those results get out until polls close. And so I think that's kind of what supporters of this are saying. They're saying, we understand concerns, but again, really hard to open 20,000 ballots in one day. And so we'll see. We'll see in the legislation. I would anticipate that it'll be brought up again. There's a push from the Secretary of State and the governor to try and make that happen. So I would anticipate that, there could be some movement on that once lawmakers reconvene.
Dave, this is an exciting time to be covering the government and politics. But as someone who has covered politics in this area for a while, especially in the city of Detroit, how is the pandemic helping or hurting you trying to do your job? And do you think it's limiting transparency for citizens?
Yeah, that's a fair question. I'm still kind of getting my feet wet and understanding. There's a lot that I don't know. So far, it hasn't been a huge hindrance for me, but I know that other reporters, especially reporters this week, have some concerns about when it comes to access. There's obviously reporters and the public have a right to public information, and so for example, when press conferences are not held in person, and when press conferences when public officials ask for questions ahead of time for press conferences, that kind of limits the ability of what we're able to do, and kind of gets away from the heart of how public officials are supposed to interact with their constituents. So that can be frustrating. That being said, I've been calling people as essentially a random person in Detroit and throughout the state the last couple of weeks, and everybody's been gracious who's answered the phone and has been very helpful in the information that I've been able to get. It's a different time. It's reporting is always a challenge, but it hasn't been overwhelming, and we're doing the best we can to serve our readers and our viewers.
Dave Boucher with us, government and politics reporter at the Detroit Free Press. Just a couple more minutes with you, Dave. Going back to the primary election, we've talked at length about how the clerks felt about this election, how the process and the processes that were in place, and how what they feel needs to be in place for November. What about the voters themselves? From what you've heard, either in your work or from other reporters at the Free Press, what's the voters' thoughts on how this process went down in the August primary during this pandemic, and are they confident that it's going to be a smooth process in November, where things may be a little more chippy politically?
Yeah, so overall, the reader feedback that we received is that they thought the election went relatively well. I mean, we heard from a lot of readers who received their absentee ballot on time and were able to either mail it in or to put it in a drop box and then check the Secretary of State's website and see that it was received. We did hear from a fair number of people, too, though, that had just questions about mail-in voting or had concerns about mail-in voting. I've heard from both voters and from poll workers that people requested an absentee ballot and either never received that absentee ballot, before the election, or they mailed in the absentee ballot but couldn't guarantee that the clerk received it by the election. That's important because in Michigan, only those absentee ballots that are received by clerks by the time polls close, 8 p.m. on election day, are valid. Those are the only ones that count. And so we did hear from some readers about that. And so we talked to the Secretary of State, we talked to clerks, and they're encouraging everyone, if they're going to vote absentee, to vote as early as possible. You can start requesting ballots, to start doing that process early. Put it in the mail as early as you can. I think people understand that there are the U.S. Postal Service is stretched pretty thin. There's a high demand on that right now. And if you're not confident in the mail system, there are drop boxes around the state. You can find the location on the Secretary of State's website. Some jurisdictions have more than others. You can always drop off your ballot at the appropriate clerk's office as well, or cast the absentee ballot early at the appropriate clerk's office. So there were a lot of questions about some of the logistics of everything, but overall, the people who voted in person and the people who voted absentee said that they felt relatively safe and relatively confident in the process.
Dave, anything else you'd like to touch on today before we let you go?
I really appreciate you having me on. It's been exciting to move back to my home state and to cover this process, and looking forward to covering the November general.
Dave, real quick before we let you go, since you are new in town, how can people reach you if they're watching or listening, or if they have tips they want to send you?
Yeah, that's great. Thank you. You can find me on Twitter at Dave_Boucher1. My email is B as in boy, OUCHER @freepress.com. And so you can reach me very easily either way. I would love to hear any tips or feedback that you have, and look forward to hearing from you.
Dave, thank you very much for being with us today.
Yeah, thanks so much for your time. I appreciate it.
Appreciate your time as well. Dave Boucher, government and politics reporter at the Detroit Free Press, with us on the Oakland County Megacast. A busy time to be reporting on government and politics. We definitely appreciate him taking some time for us this morning. We know today is a very busy day for him as well. It's a busy time for everyone in the community, especially journalists like Dave, who are reporting on the politics and on government operations for the people in government, as the August primary is done. But it's a push for November now, and I know that clerks, and we know that clerks right immediately at the end of that election, they took the rest of the night off. They maybe took a breather early on Tuesday, and then early on Wednesday, and then got right back to work for the November election. It's going to be, like I had mentioned with Dave Boucher there, it's going to be a much chippier situation politically. I think there's probably going to be a lot more urgency from people, no matter what their political affiliation is, for those elections, and it makes that all that more critical, especially given the times that we're in, that things are put in place to make sure those elections go as smoothly as possible.
Secretary of State Jocelyn Benson is scheduled to have a press conference at 10:30, so we'll try to monitor that, and if she has any breaking news, we'll bring that to you. But politics going forward, how do you keep it out of the election process? So as a journalist, you have a lot to juggle here because it's happening on so many levels. You have the local level, you have the state level, you have the federal level, and you're juggling a lot of different balls to try to make sure that you're covering this issue, especially going forward into November.
We'll continue, of course, to cover more information on the November election, the processes that are going to be in place, and any changes that may occur from the August primary we had this week up until that election, and we'll keep you posted on that as time goes on. We're going to take a quick break. When we come back, we'll talk with a local police chief about the re-emphasis earlier on this week, put in place by Governor Whitmer in terms of enforcement of these policies in place to prevent the spread of COVID-19 and much more. You're watching and listening to the Oakland County Megacast on our family of TV and radio stations. Ronnie and I will return after this break.
Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Hi, I'm Dr. Jonae Caldoun. I'm the Chief Medical Executive for the Michigan Department of Health and Human Services. The people who are at highest risk of getting severely ill from COVID-19 are the elderly and those with chronic medical conditions. That includes people with heart disease, diabetes, COPD, or those who have compromised immune systems. People who are in those categories should right now be staying at home as much as possible and not going out if it is not essential. If you fit into one of those categories, those are the things you should do. And if you have a family member who fits into one of those categories, you should be checking in on them and making sure they are following those guidelines. There's something everyone can do to protect the community from COVID-19.
Welcome back to the Oakland County Megacast. I'm Tyler Kieft alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM, our flagship TV and radio stations on the Megacast network of community television, radio, and other media outlets. In addition, as always, today we are joined by Birmingham Area Municipal Access. Much like Civic Center TV, they are on Comcast Channel 15 and AT&T Channel 99 in the areas of Birmingham, Bingham Farms, Beverly Hills, and the village of Franklin. And we're also on another great community radio station, 88.1 WBFH. The Biff joins us live today out of Bloomfield Hills High School under the leadership of station manager Ron Whittables. We thank the Biff for being with us each and every day, and all of you tuning in Bloomfield Hills and the surrounding areas on the Megacast as we continue to bring the latest news and information about the COVID-19 pandemic and so much more. Well, recently Governor Whitmer put a greater emphasis out to the state departments and the law enforcement agencies across the state to enforce COVID-19 safety guidelines as Michigan begins to plateau from its recent spike in COVID-19 cases, but wants to put more emphasis on prevention so that curve begins to go down instead of plateauing. And joining us to talk about the enforcement of those policies on a citywide level, we're pleased to be joined by the Chief of Police of the City of Sylvan Lake, Brian Bassett, joins us once again on the Oakland County Megacast. Chief Bassett, thank you for being with us today.
Sure. Thanks for having me, Tyler.
Appreciate having you on. The last time we spoke, it was one of your first days on the job. You've been on the job now as chief for a few weeks now. How are things going in the city of Sylvan Lake? How are you enjoying your new gig?
I'm enjoying it. It's been great to get to know the community, become part of the community. It's a great town, and I again honored to be here.
So, Brian, Chief Bassett, we are still very much in the thick of the battle against the coronavirus. Governor Whitmer this week had put a greater emphasis on states departments, but also on law enforcement agencies to help enforce these COVID-19 guidelines in public places and in restaurants and other businesses and so on, as cases continue to be relatively at the same spot, relatively plateauing. But the goal is, of course, to have the curve be shrinking, not be maintaining. In terms of enforcement in Sylvan Lake, has your police department had to have a lot of conversations with local businesses or organizations or even people about maintaining these guidelines for COVID-19 prevention?
Well, to your point, we've had lots of discussions internally, and what the message that we've received from the government the governor and the attorney general is that our role is one of education, and we've done our best when called to local businesses in interacting with our community, is trying to provide as much information and education as we can, because we all have the same goal, and that's to try and keep everybody safe, try and keep everybody healthy.
Chief, one of the things in Sylvan Lake is the lake itself, and you do have somewhat of a sandbar in parts of the lake, and then you have the beachfront as well. Are you running into any issues there with an overcrowding possibly?
We have not at this point. Obviously, it's something that we continue to monitor, but everybody has been respectful of each other, respectful of the requests of the governor. And at this point, people have continued to enjoy the lake. They're continuing to get outdoors, and we'd like to see that. Hopefully, everybody continues to get outside and enjoy this beautiful weather we've had.
Chief Brian Bassett with us. He's the Chief of Police in the City of Sylvan Lake with us on the Oakland County Megacast. And Chief, in recent days, we've seen a lot of reports from throughout Oakland County, mostly centered in South Lyon, about the congregation of groups of people, particularly teens, for parties and celebrations, and that's been a point of spread for COVID-19. This is also a time of the year where graduation parties from the senior class are still ongoing, and we've heard also stories about some social distancing issues and mask wearing issues at these private gatherings at people's homes. What do you say to the people of Sylvan Lake and the surrounding area who are having these celebrations that they normally have, these traditional celebrations or these rites of passage celebrations, in terms of what they need to be focused on, and why it's so important for them to follow guidelines while they're celebrating these momentous occasions in a time that we're in right now that's so critical?
As I mentioned before, we've seen our role as one of education, one of encouraging people to stay safe. We've received questions about having parties, and what we've done is we talked about what their objectives were and how to try and do that as safely as possible. Up to this point, any celebrations, people have done them outdoors that we've been made aware of, to be clear, that we've been made aware of have been outdoors and have been as safe as possible.
Chief Bassett, the police department in Sylvan Lake is really does a great job of involving itself in the community, especially in the summer months. There's yearly events every summer that the police department has been greatly involved in, especially the Family Fun Day out at the Sylvan Lake Community Center in the past. And this year, I happen to be in some of the Sylvan Lake community Facebook groups where they're posting things that are going on in the city, and I've seen a lot of unique events that have been happening there, like small outdoor concerts and talent shows and so on, that are being done at social distancing as well. What do you say to those kinds of community gatherings that keep that close-knit Sylvan Lake community together, but are still doing so in a safe manner that prevents the spread of COVID-19 in Michigan's prettiest little city?
Yeah, as you mentioned, we love to have the family fun day every year. Unfortunately, that's had to be rescheduled until next year. But Sylvan Lake has continued to be the strong community that it's always been, and they have had some of those public events. I should say this, they're privately organized, but where they've done some outdoor concerts, and everybody has just been outside, socially distanced, and it's been great to keep some of that community connection, and I think we all are so starved for. So it's exciting to see the community, and it's really, for me personally, as you mentioned, it's been a bit of a struggle because I'd love to be more involved in some of these public events, but right now everything's in limbo, and many of those events have been delayed or rescheduled. So it's great to see some of these smaller, privately organized events continue to happen.
So definitely a hard time to start a new job because you can't interact a lot with the public. But how are the officers in your department holding up? We are 5 months into this. It's getting exhausting. How are they doing, not just with the COVID side of everything, but also the shifting of attitudes towards our first responders?
Yeah, so since I've come in, I've really tried to focus on, because to your point, sometimes some of these community events, they've been delayed or rescheduled. So I want to make sure that our officers are being taken care of. We actually partnered with the state through federal funding to receive grant funding to try and make some modifications to our facilities to ensure that the officers are as safe as possible. I'm excited about that. We've also tried to update some of the technology in our scout cars, the computers specifically, to make sure that they have the tools necessary as we're working under these stressful conditions, that at least that they have all of the tools necessary. And the other thing that I've done here during this time is I partnered. It's a federal grant, but it's being administered through the state. There is hazard pay for the officers that have worked during the pandemic. We've applied for and been approved for that grant. So we look forward to that very soon for the officers. But we continue to monitor, each of the officers because, as I'm sure everybody has experienced, these are extremely stressful times, and they've been asked to continue without interruption, without break, and they have done a fantastic job, and I'm very proud of each of the officers here at Sylvan Lake.
Yeah, one of the things that we saw more in the beginning of this crisis, first responders, law enforcement officers spending the night in their car or at hotels or making other arrangements to stay away from their family. Any of your officers doing that, and have you had any positive cases that you've had to address?
We have not had any officers with positive cases here, but we have worked with our partners in the county that if officers have needs to shelter elsewhere because of concerns at home, we have those arrangements in place and ready to go at a moment's notice. So with some of with our partners in the county, we're able to make arrangements at hotels that have already agreed to shelter the officers, and also through some of the local community colleges, and Oakland University has made arrangements to house first responders if necessary. So we have those plans in place if needed. At this point, we have not needed them, and I'm grateful for that.
Chief Brian Bassett from the city of Sylvan Lake with us on the Oakland County Megacast. Chief, recently the Oakland County Health Department was going out to many beaches in Oakland County to test them for safety, for particularly from E. coli and other potential harms. And one of Sylvan Lake's beaches was closed down at that point in time. There's also in Sylvan Lake, for those that maybe don't live in the community or don't venture through the community very often, there are certain points where there are rerouting of traffic or different situations that are unique to the city of Sylvan Lake. In terms of the beaches, the ones that were closed, the one that was closed in Sylvan Lake, has that been reopened? And then in terms of everything else, what should people be aware of when they're coming into Sylvan Lake so that they're following the rules of the road in Sylvan and not impeding on people's property or the rules of the city.
Yeah, so at the end of last week, Oakland County did test Ferndale Beach, and with an abundance of caution decided to close it until they could again test on Monday of this week. After that test, the beach was opened up again. So in talking to our partners, Oakland County, was really through an abundance of caution. It was very close to their limits, but obviously anything over, they're going to make sure that we wait and that water is going to be completely safe. So those tests have now happened on a daily basis, and all of our beaches are open here in Sylvan Lake, we're excited to say. That being said, you kind of mentioned some of the traffic flow issues. From 12 o'clock on until the parks close, we actually close down the streets so that it is only open to bicycle and pedestrian traffic. And we do that to make sure that we maintain a very family-friendly, pedestrian-friendly environment here in Sylvan Lake. So it's something that you're going to have to understand when you come here. Be prepared to walk and enjoy the beautiful summer weather.
Summer is starting to wind down, sadly. We're going to be getting to Labor Day here pretty soon. Any plans in place or concerns as people start to gather to celebrate the end of summer?
Well, and again, as I mentioned, my experience so far in Sylvan Lake and on the lake is that everybody has acted appropriately. Everybody is making sure to socially distance and enjoy their family and enjoy that time with each other. So I anticipate moving forward that we'll see that pattern continue. Obviously, if it doesn't, we'll monitor and we'll evaluate what we have at that point.
Chief Bassett, thank you very much for being with us today. Anything else you'd like to touch on before we let you go?
No, I appreciate the time, and thank you both.
We appreciate it. Chief Brian Bassett from the city of Sylvan Lake with us on the Oakland County Megacast on a family of TV and radio stations, and so much nuance, even in small cities such as Sylvan Lake, smaller cities like Sylvan Lake, for enforcement of the coronavirus guidelines in terms of what they're looking for, and even in terms of compliance too. You see it's different in every single municipality.
Yeah, I think in Sylvan Lake, one of the issues that could be is just the fact that some of the beach areas are a little bit smaller. You have a lot of people gathering together, families coming together, friends and family, and we have that perception, hey, we're outside, so we're okay. But you have to remember it can spread outside as well. While the risk of spreading is lowered when you're outside, it can still happen. So that's one of the concerns in the smaller communities. You have to remember, too, Sylvan Lake also has the West Bloomfield Trail Network that goes through their backyard. So you have a lot of people out there exercising, taking advantage of that, amenity in the community. So it does bring different people into Sylvan Lake other than just residents.
Yeah, it's one of those cities that's very recreational and very wide open to the general public, but at the same time, it does have that nuance. But good to talk to Chief Bassett about those issues, about getting involved in the community, and get an update from him on his new job as the Chief of Police in the city of Sylvan Lake. We're going to take a quick break. When we return, we'll review yesterday's press conference with Governor Whitmer, some of the important points that were made at that from our clips on civiccentertv.com/megacast. We'll check in with Erica Jones from out in the field, and then in our second half of the show, we have even more interesting guests coming up. You're watching and listening to the Oakland County Megacast on our family of TV and radio stations.
This may seem uncomfortable, but so is being hooked to an IV, sleeping in a hospital bed, and fighting for your life. When it comes to COVID-19, comfort is not as important as saving lives. Wearing a mask can greatly reduce the chance of spreading the virus. So mask up, Michigan, every time you leave home.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of Civic Center TV at 89.3 Lakes FM. We're also on 88.1 WPFH The Biff and on Birmingham area municipal access. Our TV channels, Comcast Channel 15 and AT&T Channel 99. We're also online, CivicCenterTV.com. You'll click on our Watch Live link. You can watch our show live 10 a.m. to 12 noon, Monday through Friday, as well as other original and imported programming from community stations around the area on Civic Center TV throughout the afternoons, evenings, and weekends. 24 hours a day, 7 days a week, CivicCenterTV.com. And click on our Watch Live link. And you can also go to CivicCenterTV.com/megacast and find more information on our show from each and every day, including information about our partnering TV and radio stations and access to full episodes, short clips, and interviews from each and every episode of the Oakland County Megacast. And yesterday, we joined live as Governor Gretchen Whitmer addressed the state of Michigan for the first time in the month of August at her press conference. And one of the major points she made yesterday was declaring racism as a public health crisis in the state of Michigan. She declared racism a public health crisis in Michigan in an executive directive, pointing to the increased impact of COVID-19 on the black community as one example of the ways that public policies exacerbate systemic racism. And Michigan is putting forth an effort to change those policies and that status quo. Here's Governor Whitmer from a press conference yesterday.
Today, I also signed an executive directive declaring racism as a public health crisis in Michigan. I want to thank the Michigan Legislative Black Council for their leadership. This pandemic has confirmed and highlighted the deadly nature of these pre-existing inequities caused by systemic racism. COVID-19 is more than 4 times as likely to take the life of a black Michigander than a white one. And this reflects long-standing, deep societal, economic, and environmental disparities. This executive directive directs MDHHS to work with other state departments to examine data, develop and plan policies, engage, communicate, and advocate for communities of color. Dr. Khaldun will also touch on further steps the department will take to address systemic racism in Michigan. I want to thank Dr. Khaldun for her leadership. She's the reason Michigan was one of the first 3 states to release demographic data so that we could help better act to protect people in our state.
Governor Whitmer yesterday at her press conference addressing Michigan's decision to declare racism as a public health crisis in Michigan. And it was interesting that she announced this yesterday after the month of July was, of course, big for social justice movements in Michigan and throughout the United States. Other states had also made that the similar decision to what Governor Whitmer made, and good on her. I think she waited until there were some policies that were going to be in place and some groups that were going to be formed at the state level to address these issues before declaring the issue to be a public health crisis.
I'm surprised this didn't happen earlier, like you said, Tyler, just because we have seen this be an issue from the very beginning. This has always been an issue with the disparity in health care and African American and other minority groups. COVID-19 just brought it to the forefront where it couldn't be ignored any longer. But as you said, other states, other cities, other counties have already made this declaration declaring racism as a public health crisis. It seems like Michigan is a little bit late to the game on this one. And sometimes with her press conferences, you think they're going to be about COVID-19. And while it was really more about this declaration, not so much about where we stand in the fight of this pandemic and where we could be going forward. Also, the big thing coming out of this yesterday, for the first time, they were doing interviews with the media via Zoom, and they only picked a few reporters to present their questions, and they had to present their questions prior to being picked to ask the question. So I think a lot of people wanted to hear a lot more to come out of this press conference. So even if you're going to have one and this is the topic, typically at the end, reporters are allowed to ask questions surrounding other issues so that we can get some more clarification on other things going on as well.
Yeah, Governor Whitmer did provide some clarification on some of the policies being put in place to combat racism, being the public health crisis that it has been declared in the state of Michigan. Yesterday, Governor Whitmer established a Black Leadership Advisory Council, and she said she is committed to putting more marginalized voices, quote unquote, at the table in an empowered way in order to resolve issues with discrimination and racial inequities in the state of Michigan. Here's Governor Whitmer yesterday at her press conference.
Today I'm joined by leaders from across the state to announce a series of new initiatives to prevent discrimination and racial inequity in Michigan. Since I was sworn in as governor, I've made it a top priority of mine and my administration's to include more people of color, more women, more members of the LGBTQ plus community, more people who are representative of the socioeconomic classes in Michigan and the geographic areas in Michigan at the table, in not a tokenism way, but in an empowered way. We've been able to build a more inclusive state government, but there certainly is more work to do. Today I signed an executive order to create the Black Leadership Advisory Council of Michigan, which I will work closely with to develop our policies and paths to opportunity for Black Michiganders. I want to thank Senator Erica Geis, who sponsored the original legislation, for her leadership. This is the first advisory council of its kind, focusing on African American issues in Michigan. And I'm proud to work closely with leaders like those here today to build a more just and equitable state. The deadline to apply for the council is 5 p.m. Wednesday, August 19th. And the link to apply is michigan.gov/appointments. And candidates should select Black Leaders Advisory Council from the drop menu on the application.
That clip and more on civiccentertv.com/megacast. You can find links to our clips and see more from yesterday's press conference with Governor Gretchen Whitmer, where she was also joined by the Department of Health and Human Services Chief Medical Executive Dr. Jonay Caldoun, as they talked about the latest coronavirus information and issues. Dr. Caldoun making a point yesterday to say, while, as we reported in our headlines today, that the state's COVID-19 numbers have plateaued, that is no reason to let our guards down and be complacent in terms of our continued battle against COVID-19 and in following those COVID-19 guidelines provided by the state. Here's a clip from yesterday's press conference of Dr. Jonay Caldoun from the Michigan Department of Health and Human Services.
We also continue to focus on our testing. So we are now holding steady at about 28,000 tests per day, and that's about 2% of our population per week that is getting a test. And the good news is that our percent of tests that are positive is also now trending down. It's at 3.4%, down from 3.7% the previous week. Our hospitalizations and deaths continue to remain steady and low, particularly the deaths. These are all good signs, and we will continue to monitor these metrics. But as we all know, even if a trend is stabilizing, it only takes a few people to create an outbreak and have the disease spread rapidly. So these plateauing trends are not reasons to let our guard down. There's still disease spread across the state, and we're still seeing several outbreaks across the state in every region. So last week, our local health departments identified 99 new outbreaks that they were investigating. And that's an increase from the 78 new outbreaks that they had the previous week. These outbreaks continue to occur in a variety of settings. The top categories for outbreaks are our skilled nursing facilities and other long-term care facilities, social gatherings, and schools. And it includes colleges, child care centers, and day camps. So we still have to keep fighting this disease that's still very present across the state. We're seeing way too many outbreaks, and our cases are not yet low enough to think that we can let our guard down even for a moment. So that means the basics. Again, wearing masks, washing hands, maintaining 6 feet of distance between yourself and others really remain the best thing that you can do to protect yourself and the community. And please know that even though our recent numbers of deaths are low, we're still learning every day about new research on the long-term health impacts of COVID-19. So this means anyone, including young people, can have long-term lung, brain, and heart damage. So please do not think that you are invincible.
COVID-19 cases in the state of Michigan have plateaued, as was reported by the state over the last couple of weeks, but we're still very much in the thick of this pandemic, and there's still a lot of reason for people to continue to do a good job, as generally the state of Michigan has been doing in following these COVID-19 guidelines and maintaining social distance, wearing your mask in public places, so that we can continue to see either at worst a plateau or at best the shrinking of the curve of these cases.
99 cases of outbreaks that they are investigating them. And just so you know, they kind of define an outbreak as when one or more cases can be linked back to a person or an event. So 99 of those being investigated right now. Obviously, we had the story earlier, United Shore Mortgage in Pontiac investigating there, or after over 50 employees became sick with COVID-19. So it's continuing to be investigated. But here's the thing with this: as we go back to school, you have more people, kids out, but also college campuses. I know MSU is asking students to stay home if they can and learn remotely. However, as we head into the fall, we're going to start to see, I think, spikes in these numbers just from the fact that more kids are going to be gathering in schools, on college campuses, and in sporting events as well.
Yeah, we're definitely going to have more situations coming up for the potential of spread, and it's all the more reason to follow those guidelines and keep yourself, keep your neighbors, keep your friends and family safe from COVID-19. We're going to take a quick break. When we return, we'll check in with Erica Jones from out in the field, and we have more great guests coming up. You are watching and listening to the Oakland County Megacast on a family of TV and radio stations.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green
Or blue. But one thing we can all agree on to help stop the spread of COVID-19: wear a mask.
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 The ball's in your court, Michigan.
Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart, keep wearing a mask in public, and if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe, here with Ronnie Dahl on Civic Center TV and 89.3 Lakes FM. In addition, we're on Birmingham Area Municipal Access and 88.1 WBFH, the Biff. Today, as always, our family of TV and radio stations. We're also on Ronnie Dahl's Facebook page today, and for all of you Ronnie Dahl fans tuning in on Facebook Live, we appreciate you tuning in, and you can watch us each and every day on from 10 a.m. to 12 noon, Monday through Friday, here on Civic Center TV on 89.3 WBLD, Orchard Lake, West Bloomfield, Keego Harbor, Sylvan Lake, and 88.1 WBFH, Bloomfield Hills, as we continue to cover the latest COVID-19 news and information. And we're getting really close to the fall school semester, and we're checking in with Erica Jones, who's out with a local parent right now from out in the field. Erica, thank you for being with us today.
Hi, so I'm out in our local communities and I'm talking with a couple parents, Lauren and Jennifer, about sending their kids back to school. And we have the perspective, one of them has kids in private school and one in public. So getting a different perspective on how those schools are handling things. Private schools, a lot of them I know don't have a virtual option, but then we have West Bloomfield schools where they have the choice to send their kids back in person or do online. So we're going to see how this decision has been for them and just how it's been having their kids home for so long. So hi, thank you two so much for talking with us this morning.
Thank you for having us.
So tell us, how has it been having your kids home for so long out of the classroom? Do you feel like you've had to be a very pivotal role in their learning and education while they've been out of the classroom?
Yes, unfortunately for my kids, I've had to be their teacher. And it's not always good because I don't feel like your kids listen to you as well as somebody else. Sometimes they get a little bit easier, and sometimes their curriculum, if you're not teaching it the way that I. So it's been definitely an adjustment.
Yeah, and how about you? How have you felt that's been the adjustment having your kids home? Have you had to teach them?
Yeah, it's been tough, especially for as a working mom. Just finding the time, the balance, to just, and like she said, they don't listen as much as they do while they're in school. So it's really tough to get them to listen and understand that we're the teachers now.
Right. And also as a working mom, has that been a struggle? When schools first shut down, how did you handle still having to work while having your young kids home who can't be left at home alone?
Oh yeah, it was definitely a struggle. Just trying to find, childcare because my husband's working as well. So it's been difficult.
Yeah,
same.
So Jennifer, I know your kids are in private school and you do not have the option of virtual or in person. It's all in person. How do you feel about this? Do you feel comfortable sending your kids back, or do you wish you had the virtual option?
I feel 100% comfortable. I mean, I know our principal and our counselor have been vigilant with the team people, like, extensive fields of people being guided along with the CDC guidelines and all that. So I do feel comfortable, and I do think it's important for the kids to be around other kids socially. And the classroom environment is so much better than sitting at home and staring at a screen. That's what, as parents, we focus on. We don't let our kids just stare at the screen all day long. And now here we are making them stare at the screen all day long.
Yeah.
But it's definitely hard also because you also worry about your kids' health, and, this thing is spreading like fire. So it's definitely a mess.
Yeah, absolutely. And are your kids ready to go back to school, or do they wish they could continue staying home for the rest of their
both. They actually are starting to miss their even their teachers and their classmates and stuff. They need that same.
Yeah. And Lauren, I know your kids are in the West Bloomfield School District, so you have the option of virtual instruction or in-person instruction. How are you dealing with that? Has this been a hard decision for you and your family?
I think our kids need to go back. They're not getting the learning that they would while they're in school. So I think it's very important that they do get the
sending your kids in person in the fall?
I am, yes. West Bloomfield schools are taking precautionary measures, and it seems like they're on top of it. So yeah, I am.
Yeah, so both of you feel that your respective schools have done what they need to do and are in a good position to have everyone safe and comfortable when the school year starts?
Yes.
That's fantastic.
Yes.
And do you feel that if this were to get worse, would you be okay with the understanding that things would have to change and you might need to bring your kids back home?
Absolutely. I'm also a working mother. So like Lauren was saying, you have to figure out what's at stake. Then of course I would definitely want them to be home.
Yes, absolutely. Well, thank you so much for talking with us. Is there anything either one of you would like to share about your feelings about the fall that we haven't covered?
No, just fingers crossed that the kids can see their classmates again.
Yes, that'd be great. Absolutely. Well, it's great to hear from you.
All right, Erica, we're having some issues keeping your mic connected, so we're going to thank you for your work out in the field. Erica Jones with a couple of local parents with us on the Oakland County Megacast talking about their feelings as kids prepare to go back to school in the fall. And some schools have those options for virtual or in-person, hybrid learning as well, or they're going to be all one way or the other. There's options out there And there are a lot of families that are concerned or want to have the ability to choose the path that their kids go on to learn in the fall. And some school districts are allowing that, of course. Some have very one way or the other policies. And it's going to be interesting as we get closer to the school year if those policies in these school districts change.
From both parents, one in private school, one in public school, and moving forward, the decisions that they have to make to try to make the best decision for the safety of their family, but also the mental future of their kids. And every family and every kid is different. So thank you to both of them for sharing their story. And parents across the country right now are struggling with these exact same decisions. It is a hard time to be a parent right now, Tyler, trying to make these decisions for your family. Plus, you have to remember when you have working parents, and a lot of parents, not all of them are working remotely now as well. So then there's the child care issue. How do you get child care? But also those lifelong lessons where we're telling our kids, hey, you can get outside and play. Don't stare at the screen. Get off your devices. And now basically you're telling them, get in the house, stare at a screen, get on your device in order to teach them. So there are a lot of things and a lot of issues, a lot of concerns for parents to juggle as schools reopen going into the fall time.
It's definitely a challenging time. It continues to be for parents, for teachers especially, and also especially for the students. We're going to take a quick break. When we come back, we'll speak with Lionel Bradford, the president of the Greening of Detroit. You are watching and listening to the Oakland County Megacast on a family of TV and radio stations.
Hi, I'm Dr. Faust, the medical director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Welcome back to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM, our flagship TV and radio stations. In addition, we're joined by Birmingham Area Municipal Access and 88.1 WBFH The Biff as we continue to bring you the latest news and information about the coronavirus and how it's impacted different parts of our community, whether it be education, whether it be businesses, or whether it be community organizations such as the Greening of Detroit. And we are pleased to be joined now by the president of that organization. Lionel Bradford joins us now on the Oakland County Megacast. Lionel, thank you for being with us today.
Thank you for having me today.
Appreciate having you on. For those unfamiliar, what is the Greening of Detroit? What does it do in normal times, and what is it doing now?
The Greening of Detroit is a local nonprofit here in Detroit. We've been around since 1989, so we've been around for 31 years now. Our mission actually is to promote a sustainable, healthy urban community through trees and green spaces, healthy living, food, education, and job training opportunities. And so we were initially started as a tree planting organization in 1989. The goal was to reforest the city after Detroit had lost over 500,000 trees from disease, urbanization, neglect, you name it. And so we started the organization. The organization was started actually to combat that. And since then, we planted over 130,000 trees throughout the city of Detroit. And then we've branched off into so much more, and not just tree planting, but we're also, there's an education component into everything that we do. All of our work has social economic impact, not just environmental. And now we've also have community engagement, which is the thread that kind of ties everything together. In 2010, we got into workforce development, where we were looking to train Detroiters who have barriers to employment. And since then, that program, we've trained close to 800 Detroiters who have barriers to employment with an 84% job placement rate. So currently, we have a youth employment program that's running. That we're in the last week of it. We're in conjunction with the mayor of Detroit, Grow Detroit's Young Talent, a program, and that's a summer youth a job program here in Detroit. So we're working in conjunction with that. But our program is called Green Corps, and that program, we have about 50 youth in there this summer that's working. And
it appears we have lost Lionel's microphone. We'll just stand by right here for a minute. It looks like you went muted and unmuted. Let's see if we can get him back, his volume back in just a moment. And we'll stick right here. We're talking with Lionel Bradford. He is the president of the Greening of Detroit. Looks like we have your microphone back, Lionel. If you would continue, go ahead.
Yeah, and I'm sorry about that, and I don't know where I left off for you guys, but the organization right now, we're running our youth employment program. It's a summer youth employment program where we employ youth 14 to 18. And these folks generally would go out and provide maintenance to our plantings that we've done throughout the year. However, with COVID upon us, we have had to pivot quite a bit with all of our programming. And so we're running a virtual program this year for the first time for our youth. And that's we're in the last week of that program. It's a 5-week program, but the program has gone quite well. I think the youth really got a lot out of it. I've sat in on quite a few sessions. I see the enthusiasm that the kids have, but again, it's quite different from what we're used to doing. On our tree planting efforts, we've had to pivot as well. Normally, we are planting in the spring and fall, and most of our plantings are community plantings where we're using volunteers to help get trees in the ground, and we have not been able to do that because of COVID, of course. And so we were deemed essential, so we were able to come back into operations in on May 15th this year, where we've basically been using staff to put all of the trees in the ground that we planted. And so we are social distancing, we're wearing masks, and we're just really trying to cope and restructure our programming best we could to accomplish our goals and make sure that we are safeguarding our staff.
Lionel, can you talk a little bit about the importance of the tree plantings and how it helps to remove some of the contaminants in the soil? And on top of that, are you having problems getting some of the products, some of the trees that you need?
Well, yes. I mean, I think that, we've been planting trees, as I stated, for 31 years now. We planted over 130,000 trees throughout the city of Detroit. We're really working in conjunction with the city and many others that are looking to increase the tree canopy throughout the city. But trees, as you know, play an important role in urban environments in terms of soil erosion, removing contaminants from soil, which is called dendro remediation, where we use trees to actually pull those contaminants out. But not only that we see here in Detroit, we have pockets of Detroit that are heavily flooded. And
looks like we have lost Lionel Bradford's video now. We apologize for that. We've lost connection with him. We thank Lionel Bradford for joining us today. We're going to take a quick break. We'll come back and see if we can get him back, and if not, we'll continue on. You're watching and listening to the Oakland County Megacast on a family of TV and radio stations. Nope, we have Lionel back. We'll continue on with him. So, Lionel, as you continue forward with your projects in the city of Detroit, with your organization, especially in times that we're in right now, have you seen there's been a greater interest that's been put forth for gardening and for engaging in nature and beautifying the city of Detroit with your projects with the greening of Detroit during the time of the pandemic.
Yes, and unfortunately, I lost you for a minute there, so I didn't get the first part of the question. Would you mind repeating that?
Yes, as the pandemic has continued forward, and we've seen a lot of people that have engaged more in gardening and been out in nature more often, whether it be for recreation or for certain hobbies. Have you seen the interest growing in joining your operation and doing what you do at the Greening of Detroit, making these plantings that you've done for 30 plus years and beautifying the city and helping regrow in many ways the city of Detroit?
Absolutely. We've seen quite an increase, and that's due to folks happen to be home in terms of when the stay-at-home order was on. A lot of folks look to getting out into their backyards and growing gardens, planting trees in their yard, just something to get them outside in the outdoors, into the out environment. And so we've seen that. I will say, in terms of how we operate our community plantings programs, we've seen a decrease in terms of volunteers. And that's only because we cannot get together in large numbers. However, we do know that since May, when we started, into now, we've seen more people get involved in what we're doing. And it's going to take a while. I mean, as I mentioned earlier, we're living in some unprecedented times, and we want to make sure that we safeguard our volunteers that we work with, as well as our staff. And so it's going to take a little time, but we've seen both an increase in terms of when the stay-at-home order was in effect, and then a decrease in terms of the number of the volunteers we work with.
Lionel Bradford with us, the president of Greening of Detroit. Lionel, just another minute or so with you before we got to let you go. Anything else you'd like to touch on today, or any other important information that people should know about your organization?
Well, I think it's important that live in some unprecedented times, and I think getting out into nature and the outdoors is key. We promote that. We promote our tree planting efforts. If you can volunteer with us, we are taking safe measures in terms of making sure that everyone that comes out and volunteers with us will have protection, personal protection equipment, as well as sanitation stations. So we're doing all that we can to safeguard, but we do know that it's important to continue with our mission. As many trees as we can get into the ground, as many people we can train, as many kids as we can train and turn into our next generation of environmental stewards. We want to do that, and that's what the organization is about. All of our programming has not just the environmental components, but also the social and the economic impact tied to it. And so we are here. We're here for the community. We serve the community, and we want to do our part in terms of continuing to make the environment we live in safe for all.
Well, Lionel, thank you very much for being with us today.
Thank you for having me.
Appreciate having you on. Lionel Bradford, he is the president of the Greening of Detroit, with us on the Oakland County Megacast. We'll take a quick break, and when we return, we'll have more from all around the community regarding the COVID-19 pandemic and so much more. You are watching and listening to the Oakland County Megacast on a family of TV and radio stations. Ronnie and I will return after this break.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services. Michigan, we still need to stay careful because we don't want to go backwards, back to where we started. So keep standing 6 feet apart, keep wearing a mask in public, and if you have symptoms, talk to a healthcare provider about getting tested. To move forward, let's all do our part. So stay careful. Michigan.gov/coronavirus. Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's gonna be who?
And whether we wear green
Or blue. But one thing we can all agree on to help stop the spread of COVID-19. Wear a mask.
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 The ball's in your court, Michigan.
Welcome back to the Oakland County Megacast. I'm Tyler Kieft alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM. In addition, we are on 88.1 WBFH, The Biff, and on Birmingham Area Municipal Access, our community TV and radio stations that make up our network of the Megacast community television and radio stations. With us each and every day, Monday through Friday, 10 a.m. to 12 noon here on each of these great stations, online on a variety of different Facebook pages with our Facebook partners. Today we're on Ronnie Dahl's Facebook page, and we're online on civiccentertv.com. You'll click on our Watch Live link, and you can watch us in full high definition on our website, civiccentertv.com, and click on Watch Live. Here's our homepage. If you are still looking for the election results from earlier on this week, if you haven't seen some of those, you can get those there. We have our Watch Live player, and you can click on Watch Live to go and view our channel live in high definition anytime during the day. For information on this show, you can go to civiccentertv.com/megacast. Find information on our partnering TV and radio stations. Find more information about 88.1 WBFH, The Biff, as well as Birmingham Area Municipal Access, and find access to full episodes, short clips, and full interviews. In addition, if you know somebody or there's a topic that you would think would be interesting for us to talk about, you can fill out our form there. Talk to the Megacast team. Give us your name, your email, and what you'd like to talk about, and we will get back to you as soon as we can. In addition, you can find on demand our clips of each and every day's shows, our full interviews, and full episodes on demand anytime, anywhere, wherever you may be tuning in. civiccentertv.com/megacast. In addition, on civiccentertv.com/coronavirus, we have information from reputable resources from the Centers for Disease Control, the state of Michigan, Oakland County, and many local municipalities directly go into their COVID-19 pages, so you're not digging through a bunch of different websites trying to find COVID-19 information that you need to know. In addition, we have our top headlines of each and every day on the program. Today's top headline: health departments order mortgage company to enforce measures to stop the spread of COVID-19. Oakland County health officials are ordering United Shore mortgage company in Pontiac to enforce social distancing and other measures to stop the spread of COVID-19 after more than 50 workers were confirmed to have the virus. In an emergency order dated Tuesday, health officer Leanne Stafford told the mortgage company her division had received complaints that United Shore was violating a statewide executive order that requires masks to be worn over the mouth and nose when in an indoor space. The company must develop a plan to manage and control social distancing, ensure employees are wearing their facial coverings, implement a daily screening process and sick policy, as well as encourage working from home. Failure to comply is a misdemeanor punishable by up to 6 months in jail or a fine of up to $200 a day, according to the order. So, United Shore getting cracked down on by the Oakland County Health Department after an outbreak in their office, after some complaints about measures not being in place properly in the office. The first we've really seen on a major scale in the Oakland County area, but a lesson for other businesses that maybe are taking a more relaxed approach to these COVID-19 guidelines.
And it does appear as if this was a complaint from possibly an employee to the health department, and that's how they were alerted to the issue. And that is one of the things that we are seeing is this is how this is going down. Someone calls to say, hey, I don't feel safe working here, or we're not following the rules. It then prompts an investigation by the health department and some of the other state and local officials who will investigate it and then make a determination whether or not things need to be changed at that workplace facility in order to stop the spread of this virus.
Lastly, on civiccentertv.com/coronavirus, new cases of coronavirus have plateaued in the state of Michigan. The number of confirmed cases of COVID-19 is at 84,707 as of Wednesday, including 6,221 deaths, state officials report. Michigan officials reported 657 new confirmed cases and 2 additional deaths. New cases have plateaued in the last 2 weeks, while deaths remain flat in Michigan. Testing has remained steady with an average of more than 25,000 per day, with positive rate between 3 and 4%. Hospitalizations have increased slightly but remain considerably lower than they did in the month of April and onward. So some good news about the virus numbers plateauing and less hospitalizations overall, increased hospitalizations overall, but still less than in previous months, but still not a cause for letting your foot off the gas and taking precautions less seriously, as we're still very much in the thick of this pandemic.
Governor Whitmer made it pretty clear that she did not anticipate making a decision to change the level that the state of Michigan is at over the next couple of weeks. And I think she wants to keep these precautions in place as we head back to school and college campuses, because I would think that they're anticipating that there will be somewhat of a spike in these locations.
All that information and more on civiccentertv.com/coronavirus, as well as links to reputable resources about COVID-19 from the federal, state, and local level, including links to the Centers for Disease Control and Prevention, the state of Michigan, Oakland County, and some of your local municipalities in a coverage area to their direct COVID-19 pages. You don't have to dig through the depths of the internet in order to find the information that you need to know on COVID-19. It's all right there, civiccentertv.com/coronavirus. Well, we're pleased to be joined now by Jennifer Hammond from Fox 2 News Detroit. She is one of their sports reporters, joining us now on the Oakland County Megacast. Hammer, thank you for being with us today.
Hey, good to talk to you guys today.
Good to talk to you as well. So sports are finally back. It's an exciting time to be a sports fan, even a fan of the Detroit Tigers, where many people maybe weren't expecting them to have started off the season as well as they did. Let's just start off by talking about the Detroit Tigers, because this is a young team with a lot of talent in the farm system, a lot of talent on their major league roster, and a lot of great veteran presence as well in their locker room. They started off with a little bit of a surge. Of course, they hit a couple of games where they were postponed or canceled due to COVID and to rain, but it looks like the Tigers are surging right now. Do you believe that they have a potential, because they're so young and they still have that veteran presence in their locker room, that this is a team in a shortened season that could be a surprise contender in the American League?
Well, I think they've already been a surprise contender already to a certain extent, and mostly in the form of their bullpen pitching and their clutch hitting. And those are two of the most important things that really any baseball team needs. What we have seen is that there are some young guys that have come up. We're not seeing Casey Mize yet. I know that everybody is really amped for that to happen. That will still come, but they've got some guys that they're working with. Certainly they've gotten huge additions and contributions from guys like CJ Crone and also Jonathan Scope and Jacoby Jones has been incredible with the bat so far, and also with, flashing the leather a little bit there. And so I think some of those things, they're just going to kind of ride it out and see how those guys go. It is interesting that they took the first series from the Reds, and then just over the weekend, the Reds kind of came back and got them. But I think one thing we're seeing from this team is that they're really never down and out. They've shown a lot of late game heroics and things like that. They've got some pop, and I think that they may be a decent contender in the Central this year.
Jen, on a scale of 1 to 10, what do you think are the chances that they're actually going to finish this baseball season?
I had it at 10 from the beginning. I knew that there would be bumps, and I knew that there would be a lot of teams that went through these situations with positive tests. But for the most part, and give the Tigers credit, they have taken full control of this thing. And these guys and a lot of veteran leadership in that clubhouse, they have made sure that they're not going out to bars. They're not doing things that they shouldn't be doing. I mean, to a certain extent, your job depends on your health. So many of these players almost have to quarantine all over again. And a lot of them are saying that, I think until the professional athletes that aren't in some kind of bubble situation understand that their commitment and their responsibility to their teammates, to their league, and to their family through their livelihoods is completely incumbent upon them staying home, staying safe. You don't just run out to the grocery store. You just don't run out to dinner during the season. This is a time when everyone has to be hyper vigilant. And I think the Tigers have done a really good job, whether that's messaging from Ron Gardenhire or from some of the veterans. They, from the beginning, when they first got a couple of positive tests through Norris and Reyes and a couple of other guys, I think it kind of turned the light bulb went on, and they said we gotta stay safe, we gotta stay healthy, and they've done so. Obviously we've learned certain situations with the Marlins and some other teams where there's been a little bit of irresponsibility with the pandemic, and I think that's resulted in their massive cases, positive test cases, and whether those are real positives or not, as we saw this week with Matthew Stafford, it's so incredible. There's so many different scenarios where there are false negatives and false positives, and they've got to keep on testing. But baseball is doing it right by doing it every other day.
Yeah, baseball has been doing really well, and I think the Tigers, like you had said, they had their issues early on before the season even started, and then they just started to take it really seriously. They have that on lockdown, and they're a great example for the rest of Major League Baseball, and they've created some certainty in their locker room that they're going to remain safe. A sense of uncertainty, however, on the football side, especially in college football, where a lot of teams, the University of Connecticut has canceled their season. Many leagues have decided to forego having football this season. The Big Ten just released its schedule yesterday, its modified schedule that includes only Big Ten play and features a lot of changes, most notably in our area, that the Michigan and Michigan State game is going to be at Michigan Stadium instead of at Spartan Stadium, which for a Sparty like me is very disappointing. But football is football. Do you believe?
It's not that loud in Ann Arbor. Don't worry about that.
Oh no, they haven't been for a while. It'll be okay. By then their hopes will be gone. So on the side of football, it's a little more murky now. It's much more of a contact sport than something like baseball is. They're not going to have a bubble system like you're seeing in the NBA and in the NHL, other contact sports. And we're seeing a lot of players already starting to drop out of their play. Do you think, at least on the NCAA level and definitely on the NFL level, that these seasons are going to play out? Do you think they're going to be further delayed possibly, or that they may end up playing some games and then potentially canceling the seasons?
Well, that is really hard to say. That's a lot of questions, and those are a lot of loaded questions. Let's start just first simply with the NCAA season. Based on what we've seen at Rutgers, based on what we've seen from other teams not wanting to play, Ivy League foregoing their season, I do think that it's a very different animal when you're talking about college kids who are still teenagers and college students. There's going to be a lot of online learning, so that may keep some of the numbers down in the dorms. I know I have a college sophomore who's going back to Central. He's not a student athlete, but our concerns were, do we send him back, even if his classes are online, to be in kind of that incubator, which is a dorm and could potentially, foster a large outbreak of the virus. We are still under the impression or under the belief that it is better for him to be away at school trying to learn and grow and use his protocols. I think every student is different. And with these college kids, if they have a huge outbreak on campus, that will basically shut it down. And now they've seen more deaths among teens. And there have been some other, cases where graduation parties have exploded. So young people, despite what you might hear mixed messaging from, Washington, that the young people are not affected by the virus, it can impact anyone. And I always say, just wait till one kid, God forbid, on a college football team dies because they were, told they needed to play to keep their scholarship. I think it's a really slippery slope. I don't have as much confidence in college football getting through the season or even getting off the ground as the NFL. Now, with that said, the NFL certainly, it's a whole different ballgame. I mean, these are professionals. You've seen, or maybe you haven't seen, the Lions have completely retrofitted their entire practice facility in Allen Park to take care of every single thing. They've spread out their dining. They have an additional tent outside. No one will sit and eat any closer than 6 feet apart. When you walk in, you get a scan immediately. You've got all of this PPE that you have to wear, and they've got all of these separations. They've got their locker rooms spread out all over the building. Their indoor practice facility is a huge meeting room. And I think they have the money to do these things. These college institutions don't have the money to do these things, let alone if students aren't all coming back to campus, they're really going to be hemorrhaging money and their budgets are going to be a disaster. And so college is really a double-edged sword, because a program like the University of Michigan or even Michigan State, they need the football program to keep them viable financially to a certain extent, but there's no guarantees that they can keep those kids healthy and have the money to do so in a proper fashion. Whereas the NFL, and plus, that is multiple billion-dollar industry, they will get the NFL going, I believe. And what they'll do is what they've been doing. If a guy tests positive, they send him home and he goes into quarantine. He does his 10 or 14 days. And then when he comes back, if he has, I think you have to have 2 positives to return to work, because false positives are a real issue right now. Until they get the testing, I think, really fine-tuned, it's going to be a problem for any sport. But at the extent that the NFL can afford some of these hiccups, they'll be able to handle and weather a season, I think, much more capably than the NCAA.
Still a lot of question marks remaining for the NFL season as that's quickly approaching, NCAA season as well, and we'll definitely stay on top of that as time goes on. We're joined by Jennifer Hammond, sports reporter at Fox 2 News Detroit, and Hammond, to transition to something a lot less light than sports in the Metro Detroit area. Obviously, this week we had the tragic news of the passing of 97.1 The Ticket radio personality, Detroit sports writer, Fox 2 contributor as well, Jamie Samuelsen, from colon cancer at the age of 48. Talk a little bit to us about, for those who maybe aren't familiar with Jamie's work or didn't know Jamie, about the person that he was and a little bit about his story as he was battling through this fight.
Yeah. And it was a battle. And it was a silent battle. A lot of people didn't know about it. It's interesting when you read off his credentials and his resume: radio, TV, newspaper. He really was one of those guys that instead of being a jack of all trades, he was a master of all trades, because everything he did so well, so brilliantly, and with such grace. And at the same time, he was a dedicated father. He was a great friend. When he was diagnosed, a few of us were made aware of the diagnosis. And I remember just sobbing when he told me back in, I think it was January or February of 2019. And his first reaction was to comfort me. And I just thought, oh my God. I'm like, wait a minute, what am I doing here? This isn't about me. And, he fought so valiantly. They crisscrossed the United States, he and his amazing wife, Christy, to make sure they could leave no stone unturned as far as treatments and tests and protocols. And I think he was, trying to do any kind of cutting edge or new procedures to battle that cancer. And ultimately it just kept spreading. And he thought, well, maybe I can live with a chronic illness and we'll just continue to fight it like that. But in the end, the last month of his life, it had spread to his bile duct, and he was accumulating fluid in his lungs and his abdomen, and he couldn't continue with his chemotherapy. And it just was a really sad situation. And when he went on the air last Monday, it really struck me when he said, this isn't goodbye. I'll be back, but this isn't goodbye. And I just had this sinking feeling in my pit. And then we went over and visited him a day later and essentially said goodbye to him, which it's interesting because he said, this is so hard, but it's really been a blessing because I've been able to say goodbye. He saw his parents. They came in from San Francisco before he passed. His children were around him, and converse that with, I had just found out yesterday that an acquaintance of mine, a gentleman who had worked at an establishment that I often went to eat and drink, was killed in a motorcycle accident a week ago, tragically, suddenly. And I thought to myself, how do you put in perspective, one person doesn't know it's coming, the other person knows it's coming. And I think it's all a great lesson. And Jamie even said this to us, live life. And I know that we always see circumstances and things that remind us to live life. But I think every day you have to just wake up with gratitude, knowing that nothing is guaranteed. None of us knows how long we have, but it's what we do with our lives and who we spend it with. That's really the most important. And I think Jamie was really a shining example of just doing everything the right way. And he is greatly missed already, and he will continue to be, especially in his children's lives as they go through, life events. I lost my father when I was in college, and at my wedding, I remember thinking, who's going to give me away? And of course, my brother dutifully and lovingly filled in to do that. And these are just things that will face these kids for the rest of their lives.
We've lost two great people in the sports world, Tom Kowalski and now Jamie. Each one an inspiration in how they live their life, but also in their death, and that they continue to give. Tom through his organization and helping the kids around Christmas time, but also Jamie now having the courage to come out and talk about colon cancer and the importance of guys paying attention to their body and trying to get tested so that they're saving lives.
Absolutely, Ronnie. And one of the things, our friend Matt Riley, who is the one that really makes that Killer Cares Christmas charity at the Lodge go and provides so many services and funds for Team Joseph and for kids in Kego to get their Christmas. We've already had conversations about honoring Jamie. And one of the last things I said to Jamie in his room when I said goodbye to him, other than I love you, was, I am going to be the greatest champion for your cause. And we're going to make sure that your legacy continues on. And if people can understand that a simple colonoscopy could potentially save your life, I think that message needs to get out there. The message also needs to get out there that the Cancer Society, the American Cancer Society, has recently changed the guidelines from your first colonoscopy should be at the age of 50 to 45. So they're finding that more people in their 40s, and Jamie was, I think, 46 or 47 when he was diagnosed, more people in their 40s are, contracting this insidious disease and many other cancers. Cancer is so prevalent, and it's a silent killer. People many times are stage 4 before they've even had a single symptom. So we are going to work to make sure, and I know you're going to be right alongside us, Ronnie, because you always are, making sure that we continue to raise awareness and keep Jamie's memory alive and Tom's memory alive by helping people and saving other lives and making them better.
Jennifer Hammond with us from Fox 2 Detroit. She's a sports reporter at Fox 2, worked closely with Jamie Samuelsen for many years. And there's a great article written by Bob Winowski in the Detroit News and where he talked about Jamie. And a couple of the points that really popped out to me, there's several that did, was that really described from what I've heard from all the stories about Jamie and from having listened to him on the radio and been an admirer of him as a young person in this industry. He said Jamie didn't need to be the star, didn't need to have the loudest voice or the most bombastic personality, but was brilliant in so many ways. He continued on and later said, in one of my last phone conversations with Jamie, he struggled to get the words out and then said something that stopped me cold. He said he was afraid he'd die without making an impact in his 25 years here. And that for me popped out, not because of how long he was in the industry here and how much he was doing, necessarily that he didn't do enough, but he was more focused on the impact he was having on the people who read his articles, the people who listened to him on the ticket, the people that saw him on Fox 2, and the people that he interacted with
very
in
much,
those places.
yeah.
Talk to Jamie's heart about how much he cared about the people he worked with, the people of the city of Detroit, and especially his family.
Well, you show me somebody who says I don't care what other people think of me, and I'll point at a liar. Because anyone who says that, I've just never bought that notion that people, as humans, we need to be accepted. We need to be loved. That is part of the condition, the human condition. And Jamie was very much that human condition, although at times you would never know that he needed to be loved because he fought so hard for his career in the beginning. So I met him in '94 when we first started. WDFM went on the air July 11th of 1994. And he had come from Chicago working at the Illinois News Network. I had come from Chicago working at CLTV. And we both lived in the Millender Center. The company had put us up there for a month until we could find places to live. So we went one night down to Greektown to go to dinner. And I'm like, oh yeah, I'll take you. We'll go to Greektown. Because I, being a native Detroiter, thought, I got this. I know the city. So we go and we eat. And we shared a pitcher of beer. And of course, you know, that nervous kind of, oh, do you drink? Do you want a beer? Do you like beer? So we started drinking a couple of beers and had several pitchers of beer and just started talking it was such easy conversation with Jamie always and laughing. And then we started walking around and he's like, well, what is there to do in Detroit? And I'm thinking to myself, I don't know, not a lot. I haven't lived here for 6 years. So we got on the People Mover. We went to the People Mover stop and we got on it and took a ride. And he's like, is that it? And I just remember thinking, what great, he was so irreverent. And it was just so great the way he said it. And here I am like, you know, I'm the native Detroiter. I'm going to show you how cool Detroit is. And we just went around the block on the People Mover. So from that point on, we were really, really good friends. And so many moments of my life when we've done things. He was at my wedding. I was at his wedding. And, you know, his children have been on our show. There's just a lot of light when Jamie was in the room, you know, just a sweet, wonderful guy. And we're going to wrap our arms around his wife and his kids. And I haven't read Wojo's column actually yet. I told him that yesterday. I said, I can't. I haven't been able to find the time because I know it's going to take me out at the knees. And I don't know when I will because I've heard a lot and seen a lot of their relationship. So you know, it's been a really hard week. Surreal, very surreal week.
Jennifer Hammond with us, sports reporter at Fox 2 News Detroit, and also a close friend for many years of Jamie Samuelsen. Before we let you go, Hammer, anything else that you'd like to touch on today, or how can people get involved in battling colon cancer in Jamie's honor with, of course, his community of colleagues, friends, family, and people in the city of Detroit?
Yeah, I'm glad you asked. Well, the first thing they can do, obviously, is call and schedule their own colonoscopy. If you're 45, if you're 44 and a half, if you're 50, if you're 55, and you haven't had your colonoscopy yet, call and get it scheduled. We actually had Mike Stone, Jamie's morning show co-host of The Ticket, said that a friend of his who's a colonoscopy doctor, I don't even know exactly what a colonoscopy doctor is called, but they've had a huge increase in people calling to schedule colonoscopies. And it is by no accident that Jamie has helped that message. So call and get your colonoscopy scheduled and stay tuned because by whenever it is healthy and safe for us all to gather again, we will be together, not only in a memorial, you know, a tribute to Jamie, remembering Jamie, but also fundraising for anyone who has colon cancer, who needs to get screening, who maybe doesn't have health insurance, who, you know, doesn't have access, anything. It's so important. These screening things are so easy to do. I had my first colonoscopy at 50, and it was great when there were no polyps. And he said, you know what, see you in 10 years. And I think I may go back after 6 years, just to make sure, just to make sure. And your insurance covers a colonoscopy if you have it. If you don't, then we're going to make sure that there's a place where people can go to get help so they can get a colonoscopy, so no one else has to suffer and go through this horrible death.
Well, we thank you very much for being with us today.
Nice to talk to you guys.
Nice to talk to you as well. Anytime. Jennifer Hammond from Fox 2 Detroit, sports reporter and a close friend of Jamie Samuelsen, and just seeing in the last week with him going on the ticket on that Monday on his show with Stoney and talking about his diagnosis with colon cancer and his experiences so far in the time that he had since he had been diagnosed, and reassuring the community and reassuring the listenership and Stoney and Heather and everybody there that he's still with them, he's still fighting, and he's going to be there, reassuring the public that he's not going anywhere and trying to keep them comfortable. It really showed the personality of Jamie Samuelsen and how much he cared for the people of the city of Detroit and for those that he held close.
For guys, this is an uncomfortable conversation a lot of times. So when we have someone such as Jamie to go through what he went through, but at the end of it being a message to all men out there, and actually all people, it's not just men, it's women as well. I lost my stepfather to this about 10 years ago, and as Jen said, it's a horrible death. Everyone who has a loved one that went through cancer, you've gone through it. My stepdad as well went through countless experimental treatments. When he knew they couldn't help him anymore, he was like, use my body as a guinea pig so that I can try to help save lives. And so the more we talk about this, the more we make it acceptable, the more lives are going to be saved.
It's absolutely critical that people get these checks, and if nothing else, Jamie's experience can serve as a lesson to you. If you need more information on getting a colonoscopy, talk to your primary care physician, talk to any physician that you can to point you in the right position, the right direction to find that information. We'll take a quick break. And we'll be joined in just a moment. Or actually, we'll stand by. We'll stand by here, and we'll be joined in just a moment by our good friend Dr. Jamie Taweel to talk about just how critical this procedure, this colonoscopy, is, and when people should go get it, what the process is like, what people can expect, and why this is so critical for people to get this procedure done, and maybe not wait until you're 50, and maybe wait until you're older. Follow the American Cancer Society's new directive to get your first colonoscopy at 45, and if you have other risk factors, maybe it should be a little bit earlier. We're pleased to be joined to talk about this and more with Jamie Taweel, Dr. Jamie Taweel from Grand River Medical Associates, our final guest today on the Oakland County Megacast. Dr. Taweel, thank you for being with us again.
Thank you for having me as always.
Appreciate having you on. So we just spoke with Jennifer Hammond from Fox 2 about, of course, the tragic passing of Jamie Samuelsen, local Detroit sports, radio, TV, and print personality from colon cancer at the age of 48. Really has put a new emphasis in the Detroit community, Metro Detroit community, on the importance of getting a colonoscopy. For those who are unfamiliar, what is a colonoscopy and how critical is it or life-saving can it possibly be for someone that gets that procedure done?
So a colonoscopy is a direct visualization of the inside of the colon with a camera. It's called a colonoscope. So basically what happens is the patient would undergo light anesthesia, kind of sedation. They would still be awake, but they would not be conscious to be feeling any of this. As the gastroenterologist, which is the doctor that does this procedure, will advance a scope into the rectum and look at the entire colon to see if there's any polyps. As my old instructor used to always say, not all polyps becomes cancer, but all cancer comes from polyps. So if they can go in there and catch it early and remove it and look at it under a microscope and see if it's a propensity for colon cancer, then you have the ability to save lives. I mean, colon cancer is a big killer of Americans. It's, roughly 50,000 Americans are dying yearly from colon cancer. And it is one of the most preventable cancers, because if you can get to this before it becomes an issue, that's your biggest risk, your biggest prognosticator for mortality is how advanced you find it when you do. And it's a relatively asymptomatic thing until it becomes, once you start getting symptoms of colon cancer, 9 times out of 10, it's advanced to the degree where treatment becomes a problem. So,
Dr. Taweel, what age should someone get a colonoscopy? And on top of that, are there symptoms prior? Or is this just, hey, I'm reaching this age, let me get one?
Okay, gotcha. So every patient should be getting yearly physicals, and during those physicals should be getting age-appropriate cancer screenings. So, for example, a female who hits a particular age will start getting, asked to get mammograms routinely because those are other preventable cancers. Men will also start getting prostate screenings as per the guidelines as they come out to, age-appropriate screening, and colonoscopy is one of them. Now, a colonoscopy, typically, there's different, the American Cancer Society released new guidelines suggesting that everyone at age 45 and above gets screened. The gastroenterology guidelines are still at age 50, but you can make a case for 45. So at age 45, you start getting screened for a colonoscopy, and it's typically, every 10 years, but sooner if they find something on that colonoscopy that would require a little bit more of a closer surveillance, so to speak. There's cases where you would need to get it before age 45, and that would be if you have the pre-existing conditions, genetic predispositions for colon cancer, such as FAP. These are like genetic mutations that create a lot of polyps that could be potentially cancerous. If you have an inflammatory bowel condition like Crohn's disease or ulcerative colitis that puts you at higher risk for colon cancer, that needs to be routinely screened. And a first-degree relative with colon cancer. So if you have a brother or a sibling or a mother who has had colon cancer, your screening begins 10 years prior to that, the age of diagnosis, or the age of 40, whichever comes first. So if someone got diagnosed, let's say your mother got diagnosed with colon cancer at age 53, your first colonoscopy should be at 43 or 40, whichever you hit first, and that being the case.
Dr. Jamie Taweel with us from Grand River Medical Associates with us on the Oakland County Megacast. A lot of people are turned away from getting colonoscopies, not by their doctors, but just by their own psyche, because of the process of getting to the point to have that colonoscopy. Can you speak to a little bit of what people expect to go through as they're approaching that procedure, and whether or not they're going to have pain, or if it's going to be an annoyance to them, and why it's still so critical to fight through that in order to get this procedure done that could potentially save your life?
Well, absolutely. The worst, the joke is always the worst part about the colonoscopy is the day before, because that's the prep. And, in order for them to directly visualize the colon, you need to have it cleared. And so you're going to be drinking a prep that's going to, unfortunately, it's not the most comfortable thing in the world. You will be in the bathroom, for lack of a better word, just, clearing yourself out. And that takes a while. And that's what a lot of people get really upset with. Excuse me. The other issue people have is that when they need someone to help drive them, they can't drive home by themselves from these things. So it does tie up a lot of people's time, and it can be, patients are resistant to it for a lot of different reasons. And a lot of it is the prep work, and some of it is the fear that they may actually find something. Other issues remain to be that, I don't feel anything. Patients often say that to me, like, I don't understand why I need a colonoscopy. I don't feel anything. I feel great. Well, that's the time when you want to catch something like that. Because if you get to the point where you're having symptoms, blood in your stool, constipation, abdominal pain, things to that effect, by the time you get that diagnosed and you have symptoms, chances are it's advanced to a degree where treatment becomes a problem. So, not a problem, but your risk for survival starts to go down pretty dramatically. Now, there's other options. If people don't want to get a colonoscopy or can't, for example, they are on blood thinners, or they are, patients that are on oxygen, they are not stable for the light anesthesia that one receives from a colonoscopy. Other options are available, such as Cologuard, which is a fecal DNA testing for colon cancer. So what will happen is a box gets mailed to your house. The patient would submit a sample in that box, mail it back to the company, and they will actually test it for DNA for colon cancer as well as for blood. And if it's positive, then they have to go get a colonoscopy, and we have a little bit more of a risk that there's something potentially dangerous there.
Dr. Taweel, thank you very much for being with us today.
Absolutely.
Appreciate having you on. Dr. Jamie Taweel from Grand River Medical Associates. He's an internal medicine specialist talking with us today about the importance of getting your colonoscopy. It's so critical, and if we've ever had a better example in Detroit, it's been the impact that we've seen from the life of Jamie Samuelsen, a local Detroit sports analyst and personality who tragically passed away last weekend at the age of 48, and it affects people young and old. Cancer does not discriminate, and so getting procedures like a colonoscopy are so critical to potentially saving your life.
So many times, too, we think about this in connection with men, but it's equally important for women as well. You heard Jen say that she had one a few years ago. So we need to all remember that this is men and this is women. And one test, a few hours of being uncomfortable. I went with my husband when he had his. So, when you have it, it is uncomfortable. And like he said, you are out, you need someone to drive you home, but it's worth it. Plus, it's peace of mind.
Yeah, it absolutely is. And that is going to do it for our show. Just about 40 seconds left in today's program. We appreciate you tuning in and appreciate all of our guests on today's program, from Dave Boucher from the Detroit Free Press, Brian Bassett, the Chief of Police in Sylvan Lake, Lionel Bradford from the President of Greening of Detroit, Jennifer Hammond from Fox 2, and Dr. Jamie Taweel from Grand River Medical Associates, as well as our entire crew. And just to take one more quote from Bob Winowski's article about Jamie Samuelsen in the Detroit News, he said, "So many people move in and out of your lives, but you only get a few rocks and pillars." And we challenge you and inspire you to be somebody's rock and pillar in these continuously tough times that we're living in. That's it for today's Megacast. We will return on Friday at 10 a.m.